Stand by, please.
Him Plus. Learn more right after this.
Looking for these? You drive Buzzed. It could be one very expensive ride.
First, you gotta make bail. Then pay me to get your car back.
Your insurance premiums will go through the roof.
And my legal fees just keep adding up. All told, it could end up costing you $10,000.
Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
Welcome to Community Watch. Greg.
Doc, be easy now, man.
Oh, that's right.
My shoulder.
In fact, you might need some medical treatment.
I need some examinations. I'm due for some this year.
I know a place where you can get some.
I know a place too.
For free.
For free. Yes, for free.
In fact, not just one single examination, but you can get all kinds of things checked.
And I do every year. And I have to give you credit for that. You have made me more conscious of being, doing those checks. But Health Initiative for Men and now women, it's a Him Plus, you're absolutely correct. You can get quite a few different screenings for free. And even some follow-up information. So it's a lot.
Now, I know that the particular success of this program has got to make you proud.
We are. As a member of the 100, this is one of our flagship programs. We have great partners, but this is one of those programs we are proud of. We say this program actually does save lives. Over the years, at one point, we was averaging about 2 people a year diagnosed with prostate cancer. And we believe, well, we don't believe, we know we have had a life-saving event, and so we believe in this program. So, I mean, with all the tons of screenings, people come there and they find out they have high blood pressure, high glucose. I mean, so we know this program is a benefit to the community.
Well, that is the subject of the show today, Him Plus.
Him, Health Initiative for Men and Women.
So we will find out a little bit about the history and find out what actually would happen to folks who go on that day. So it's an important show, and there might be maybe 3 people out there who don't know about this event.
Yeah, Him, yeah.
But even if they know about it, they need to be reminded that it's coming up soon. So stay with us. We'll have some guests join us after this. Do not go away.
Traditional light bulbs actually generate 9 times more heat than light. Switch to Energy Star light bulbs, and you'll realize just how much cash you were really burning through. Saving energy saves you money. Learn more at EnergySavers.gov.
Welcome back to Community Watch, and we're very happy to have with us today Reggie Sanders of the 100 Black Men of Rome in Northwest Georgia, and Aaron Hernandez, who is I'm going to take a breath now, Executive Vice President of the Northwest Georgia Regional Cancer Coalition. That's great. You get that on a card?
I do have that on a card.
See,
Takes the whole side.
That's fine print.
Well, I'm so glad y'all could be with us today.
Thank you for having us.
Thank you for having us.
This event is in what year? What year is this event?
I'm honestly ashamed. I was trying to think of that. I'm thinking because Foundation Camp is 12, so I'm thinking about 15, 16? 16, yeah.
16 years. So this event is a teenager who can now learn to drive. I mean, I could legally drive.
Yeah.
That's right.
Yeah.
And it has made it has grown.
Tremendously.
So I guess let's start a little bit with the history of it. 16 years is a good long time for it, and it's successful because if it wasn't,
Yeah.
it wouldn't still be happening.
Mm.
So 16 years ago, now the health initiative is actually one of the programs that the national organization is concerned with.
Yes, health and wellness is one of the 4 pillars of every chapter of the 100 Black Men of America. So all 106 chapters do something around health and wellness.
But this event is unique to
Rome in Northwest Georgia. Mhm.
right. So I'm assuming that aspect of the national organization is what maybe prompted this event, but way back.
Well,
What
if
was
Aaron and Mr. Sanders don't mind, I can go over that just quickly. Roughly about 17 years ago, Dr. Crane had came to the 100, and he wanted to, because he had done his PhD.
Crane.
Dr. Crane has done his medical work in prostate cancer, and he had realized the high prevalence in African Americans in the Navy. So when he came out, he came to the 100, and at that time, we really wasn't prepared to do something like that. So we said, thank you, but no thank you. Well, the next year, National came out with a mandate saying they wanted every chapter to become more active in prostate awareness. So naturally, at that time, I think Adams was our president, and he asked Brother Morrow if he would reach out to Dr. Crane, and he did. And him and Dr. Crane, pretty much, Dr. Harbin Clinic and the 100 laid the foundation for what we are celebrating or we preparing 16 years later. So it originally started, I think, with about 25 guys 16 years ago, and just doing prostate screenings, and it has grown to now it's really a complete family affair and hundreds of people.
So, do y'all have a sense of how many people attended last year?
Around 400.
400.
We've had 400, 500.
Yeah.
Last year, we did not have as many women because it was the first year that we invited the women to be a part of it. It used to be just men, and then about 4 or 5 years ago, the Cancer Coalition started a women's health fair as well. And we were basically doing the same thing at the men's and women's health fair, and all of our community partners were so great to come and join the team, but they were coming, back to back 1 month apart. So we decided to combine it. It was just a better use of the community resources at that point. And plus we noticed that women tend to bring their men to the men's health fair, so we don't really want to punish them by saying, no, you have to come back in a month and have your screenings then. So we just do it all together, and it really has become a family affair, and it's helping take care of one another. So we really want this year to make sure we get the word out that women know to come to. And I think they probably did about October last year when they're like, oh, you mean we missed it? So sometimes people have to kind of feel it to remember. So hopefully this year people will be there.
Now, with the addition of women to the health initiative, does that multiply the different screenings, or is it basically the same?
Well,
screening?
With catering to women, we definitely have to add screenings that address women-related issues. And with that being said, we've added mammograms and pap smears to the program. And this year, we hope to reach out to about maybe 250 or so women to provide free pap smears and mammograms.
And the irony of that is, for years, women came.
They did.
And they would sit and wait
Right.
while their husbands or boyfriends went through the screenings, and it was kind of...
Well, and we have providers that are fantastic. I mean, Redmond provides all of the finger sticks for the glucose and the cholesterol screenings, and then Floyd does the follow-up with those participants that need additional, information and service that day. So, you know, they have so many that they can bring, and so sometimes we would have people that would maybe get stuck that day, and then they would come back to the next fair, and it really wasn't, you know, they didn't need to have it done that often, so it's just a better use of that resource, and everybody gets exactly what they need. We also do the clinical breast exams with the mammograms. I wanted to chime in with that, and we usually do about 100 pap smears too, so that's really great. The health department provides all the materials for that, the equipment for that, and it's just a great service for women.
So, and this is free.
It's all free.
All free.
So I'm thinking, if you were just measuring what those two tests
right.
would cost someone, I mean, we're talking, I don't know, I mean, I don't know what we're talking, but it's a huge amount.
It is.
So it's remarkable, really.
Well, you just think, I went to the doctor the other day, and I literally was not in the doctor's office 5 minutes, and that roughly ran me about $160. And I had to pay it because I hadn't met my deductible.
Right.
Sure.
So, and I was just, I mean, honestly, I was in there about 5 minutes.
And that probably wasn't even blood work or anything like that. That was just to see, right.
Yeah.
And Dr. McCoy joins us every year. He is great to kind of run triage for patients that may have really high blood pressure or really, really high sugar, because they may not can wait till Monday, but they don't necessarily need an ER visit that weekend either. So he kind of, you know, gets everybody calmed down, settled down, kind of sees, you know, what's going on and what can be done right there. So we're really fortunate to have his service every year, and lots of other just great physicians and the residents from Floyd and nurse practitioners and the doctors from Northwest Georgia Medical Clinic come and help us do the pap smear. So it's just a really great community effort.
Now, over the years, we talked a little bit about the history of him. At the inception, 16 years ago, our focus was on how to target African American males and bring them into a situation where they could go and get screenings, where they would feel encouraged and comfortable. And over the years, the initiative has spread to include a wealth of services, a multitude of services that, you know, everyone in the community, regardless of which aspect or which part of the community you're coming from, can participate and find a worthwhile, you know, health-related experience while you're there. This year, we've expanded it to, of course, include women, as well as provide education on healthy eating habits and healthy ways to prepare meals. So, you know, again, we are continuing to build the program and to expand the footprint to encompass more than just screenings. While that is important, we're hoping that going forward, we can provide education that allows people to live healthier lives to help offset some of the health risks that are associated with unhealthy eating and habits.
That reminds me, I remember, and we didn't do shows on him in the early years because it predates us as a TV show. Yeah. But
not by much.
Not by much, just by a little bit. I remember the earlier shows about the initiative. We talked a great deal about how men, especially, were less likely to seek medical help, less likely to go see a doctor, unless they were just, you know, in serious pain or some horrible thing had happened.
It's too late.
Yeah. And I wonder if that has changed at all, because, I mean, the initiative has changed, it has broadened. Are men any better about seeking medical help now?
Well, I think that the nature and the communication around health has improved and it's taken a different tone, and it's included men. We have more education and awareness around men-related issues and when we should start looking for those particular issues, especially in our community. And I think that's definitely aided with helping to encourage and inspire men to come out. At the HIM event, we have a line of men excited about the program and waiting to get their screens, and they come back annually. So I think that you know, education, shows like Community Watch are doing a great job of encouraging men and spreading the word that we need to get out before we're at a critical mass situation. Erin?
I was going to say there's strength in numbers, and I think some of these guys have met each other in that line, and they come back year after year. That may be the only way they know each other. And I was telling the story, maybe on the radio when I was on the radio the other day. And there's this one little lady that has come for the past few years to the women's event, and then she was at the men's event last year, and she was so excited to come and show me. She still had her sheet that she took home with her from the year before, to where her numbers had gone down, her cholesterol had gone down, her sugar had gone down, and she and I had a conversation about, eating some baked chicken instead of fried chicken, and we don't always have to have cheese on that broccoli, and eating a little better. And she was so excited. I mean, she just made me cry, and I was like, that is exactly why we are here. And she comes year after year after year, and that's really what it's about. And we could tell you some stories. I couldn't, because I'm not in the back waiting in that line, but my husband has worked that line before.
Save them.
Okay.
Because we have to take a break.
Perfect.
Don't go away. Much more to come.
My college offers classes that meet my educational and career goals.
With opportunities outside of the classroom.
Where the faculty know me by name.
My college can prepare me for my career.
I can earn an associate's degree and transfer credits to a bachelor's.
My college is a state college within the University System of Georgia.
My college offers courses that fit my schedule.
It's where excellence begins.
We are.
We are.
We are.
We are GHC, Georgia Highlands College.
Welcome back to Community Watch. We're talking about HIM Plus, Health Initiative for Men and Women, which is in its 16th year and is coming up soon, August 19th?
August 19th.
August 19th. It's a Saturday.
It's a Saturday.
And we'll be, as always, at the Health Department?
Yes, sir. Yes, sir. Floyd County Health Department from 8 a.m. to noon.
8 to noon. And free.
Absolutely.
And I guess I should say what you were beginning to talk about before the break is that in a lot of ways this is a social event.
Very social.
Very social.
It is.
And that people come just because it's an opportunity to be with a group of people they know, and so it's just kind of incidental that they're having all of these tests while they're hanging out.
I think it makes it more comfortable when you have a group of people that you know, and it's not like you going to the doctor to get this scary information, because it is very social. I remember I used to go before I used to even get prostate screening. I would go as a member of the 100, and so I would do what screenings I could do, but then the rest of the time you kind of just interacting with people, and because we had an older population, you would actually just be listening to some of the stories. I would listen to these old guys talk about different things, and so it is a very social event, and it's really unlike any health fair I've ever been to, because even though you're doing these healthy screenings and healthy information, it is so social that I think you can easily forget that
Right. Right.
So I know that the event started primarily as a prostate screening event, and through the years, and maybe even annually, there have been a few positive tests.
And it's still that's still a key focus for the 100. Is prostate screening. We have all these additional screenings, but we, as the African American population, as men, prostate is still one of those things that we we suffer from greater than the majority community. So it's still a key component for us.
Is there a sense that that men in particular are getting checked more regularly? Are things changing in any way?
I think we've had some changes in the guidelines over the past few years, and that has kind of changed a little bit for a few years. We, as a group, we kind of had to make some decisions as to the amount of screening we would do. We only screen those that fit within the guidelines, but there was kind of a recommendation not to do community-based screenings. And so that kind of, the past few years, we've looked at that, but we have continued to do those screenings because the 100 has always said this is still really important to our target population, and we agreed. What's interesting is now their philosophy is kind of catching back up, and I sit on the state Georgia Cancer Control Plan steering team, and we are looking at that again. It was not in the cancer control plan in the past couple years as we drafted the new version, simply because of the guideline recommendations. However, we know that in Georgia, we have higher rates of prostate cancer among African American men, and that's something that still needs to be addressed. And so we have a whole task force that's looking at that, and right now the recommendation is, we probably need to put that back in the cancer plan.
Absolutely.
So it's interesting. So this year, we are committed and we are doing the full gamut and we are ready to go. So, and I would even say in the past couple of years, we've had more people participate in not only the PSA but also the DRE. So I do think that the knowledge and the awareness of how important the screening is increasing.
Do you know what DRE is?
Digital rectal exam.
Oh, okay.
Really, I know what it is. I have preferred doctors too.
Yeah. I'm sure you do. But as the event has grown, the prostate exam has become just one of a whole
It is.
Array of various things, and I don't know if we can even name them all, but
we can. Would
okay.
you like me to?
Sure.
As Reggie mentioned, we will also have for women pap smears, the clinical breast exams. Flo will be on hand with their mobile mammography unit to do mammograms that day. We will also have glucose, cholesterol screening, skin screening for skin cancer. We will do dental screenings. Walmart will be there to do vision screenings. So we really just have a large array. We try to add a few things, and sometimes it changes year after year, just kind of depending a little bit on what providers are available. But we've also have lots of vendors there, as we were talking earlier about education, social services that people need. If people are worried about other things in their life, they're probably not as worried about their health. And so, we want to make sure that people, get the things that they need.
Well, I was thinking while you were naming those different tests, that it's not going to be just a money-saving option for people, and even people who are well insured still have to pay co-pays, and co-pays are going up. Mine certainly went up this year.
Welcome to the club.
But an amazing time-saving event as well, because normally to get all of those tests you would have to go to multiple doctors, multiple places, different days probably. So I mean the convenience factor is huge.
Absolutely.
I don't know why y'all aren't just overrun with thousands of people. I mean, not that you.
We don't really want thousands.
No,
I think we're fortunate to live in a heavily medical community, and so we've always had other events going on. Like you had the women's event. I know the Hispanic community, they at one point was having one. So I think we've been fortunate that with the numbers that we get compared to what everybody else is getting, we're serving a greater community. But we've been fortunate that you have several health fairs in Rome.
Sure. We also have, affiliate branches of the 100 Black Men around Northwest Georgia, in Tennessee, and in other areas, in Atlanta and outside of Atlanta, that have a mandate to perform these types of health clinics, for example, and work with neighboring partners, community partners. So I would attest that this is probably one of the better attended health initiatives, in Northwest Georgia, as well as, in some of the neighboring cities. So we're doing a great job of getting the word out. We're doing a great job of providing services that are meaningful to the communities that we target and service. And I think we're doing an even better job of making it comfortable and fun. In addition to getting screenings, about every 15 minutes during the course of the day, when you guys come out and participate, you'll see me ringing a bell and giving a door prize.
Which I don't understand why we do that.
And we have biscuits.
That's right.
We have food.
Serve lunch. We do everything that we can do to ensure that health becomes a center of culture and lifestyle, and people are comfortable and have a great time when they come out and participate. We love to see 1,000 people, and I don't doubt, as this corridor of Georgia continues to grow and thrive, that at some point we'll be overrun and may look for several different locations throughout the course of the year to perform the event.
I also know that one thing we're discussing internally is that we have a desire to have kids more involved. and health initiative. Since we've added women, really we want to evolve to a complete family, because if you can get kids learn about their health early, then you don't have to necessarily do all these screenings when you get older. And so we're looking forward to that. We've been discussing it, but that's one thing that, to keep pushing it and keep evolving it so that we actually have things where kids can participate so they can actually start learning about this whole health process.
Absolutely.
We know another aspect that seems to have developed over the years is the wellness aspect that you mentioned.
Yes.
And that may be a trend with medicine generally, to try to prevent the need
Absolutely.
for treatment. So is that a big focus at this event?
It's a big focus this year for us. As Greg stated, Aaron and I and the rest of our community partners have worked to ensure that children, kids, and teenagers are an integral part of the health initiative this year. So with preventive measures in mind, we hope that if we can educate them now, they can adopt better and healthier behaviors that would offset and maybe even mitigate health risks down the line.
And something we've done very successfully for years is work with the health occupation students at Rome High School to help us as volunteers that day. They help serve as guides around the health fair. They help do the BMI, like the height and weight stations and blood pressure stations, because they've already been trained in that. We've had a few of our students even help us with like Spanish to English translation and vice versa, and help us with the pap smears. And they are fantastically mature and professional. We really couldn't do the fair without them. So it kind of gives them, most of them are training to go into some type of health career later. So we're looking to help them see what they want to do in their future and kind of build this community of community providers. It's not just about working in the healthcare office, it's about giving back to your community on a Saturday morning. So we think that has been especially successful as well.
And how great for their resumes.
Absolutely. It's fantastic.
Yeah. And all right, so folks who are interested in coming out that morning do not need an appointment?
They do not need an appointment.
Except for mammograms.
Right.
Yeah.
And if they want a mammogram, they usually do 25 mammograms. That's about what they have time for that day. However, usually if they have more people continue to call, and a lot of times that's because it takes a physician referral, and Floyd takes care of all of that for the people that call them. But the number for that is 706-509-6840, and you choose option number 1. And that will get your time slot for the day for a mammogram. Of course, we do the clinical breast exams that day, and we have had people who have had a clinical breast exam and realized that maybe they weren't signed up for a mammogram but needed one. And so we escort them, a volunteer will take them, introduce them to the nice ladies at the Floyd Breast Center, and get them registered and signed up for a mammogram in the very near future.
Well, we'll give that number again at the end of the show.
Quick fact though.
Yes.
On that day, historically, we do more HIV testing on that day than the AIDS Resource Council do all year long. So it's just more than just prostate and blood glucose. So we're very proud of that. And we used to give more blood. African Americans gave more blood on that day than any other day of the year in Floyd County.
That's impressive.
It is.
And sometimes in the community, if you're looking for a community resource, it takes you a while to reach out and find who you need, but everybody's there that day. And if you go to one table and they don't have it, they're going to help you find that person in that room that's got it.
That's right.
Well, we're coming up on a break here. We'll give you the particulars you need for this event. When you come back, do not go away.
My college offers classes that meet my educational and career goals.
With opportunities outside the classroom.
Where the faculty know me by name.
My college can prepare me for my career.
I can earn an associate's degree and transfer credits toward my bachelor's.
My college is a state college within the university system of Georgia.
My college is affordable.
It's close to home.
My college has online opportunities.
It's where excellence begins.
We are
GHC, Georgia Highlands College.
Welcome back to Community Watch. The 100 Black Men of Rome's Northwest Georgia's 16th Health Initiative for Men, now Plus, is coming up August 19th, 8 to 12 at the Floyd County Health Department. Free screenings for all kinds of health issues. You just show up unless your woman who needs a mammogram.
Correct.
When you need an appointment, and who do you
Yes.
call?
You call the Floyd Breast Center at 706-509-6840 and choose option number 1.
But for everything else, just show up, and you need to go. This is a remarkable community event. Thank you both for being here.
Thank you.
Thank you, and we'll see you next time on Community Watch.